vic.gov.au/vaccine website. So the department was notified of 6 new cases overnight, which brings the total number of cases linked to this outbreak to 15. The 15th case we've just been notified of, and that will be included in tomorrow's numbers. As we know, the first 4 cases are spread across 3 households, but within the same family unit. Yesterday we announced case 5, who was a contact of case 1, and cases 6, 7, 8 and 9 who are in different households to case 5, but as I said, in the same family unit. Cases 10, 11 and 12 are workplace primary close contacts of case 9. The workplace is a finance firm located in Port Melbourne. Case 13 is another contact of case 1. Cases 14 and 15 are workplace contacts of case 9. Interviews and investigations for these new cases were underway overnight with new exposure sites published, and Minister Foley will take you through those shortly. Ultimately, these new cases underscore the importance of people coming forward for testing. It's only through testing that we can uncover the sequence and the chain of events, and we're working our way along that chain very rapidly. So in the last 36 hours, we went from case 1, which was the first line of investigation, to identifying cases 2 to 5, the second line of investigation, to identifying 7 to 9 through the third line of investigation, and then cases 10 to 12, the fourth line. So there's still some way to go, but what's clear is that our public health teams are working very fast to test, trace and isolate this outbreak. These cases are linked, and that's a good thing, but we are very concerned by the number and by the kind of exposure sites. So the good thing is that these cases are all linked, and that is a very good thing. But as I said, we are concerned by the number and the kinds of exposure sites. If everyone who has symptoms goes forward and gets tested, if everyone who has been at any of the exposure sites follows the public health advice, if we keep following that train of transmission, then we can get on top of this. Our additional COVID-safe measures to support that effort too are helping to reduce transmission where it's likely to happen most, which, as we talked about yesterday, is in inside our own households or in private and informal gatherings outside. So those settings came into place at 6 p.m. last night. So I want to thank all Victorians for their cooperation. It was great to see coming into work this morning everyone who has their face masks on and are following the advice in terms of those gatherings. I want to thank people for their understanding and the changes that they've had to make for gatherings and events that they've got planned over the next few days. Before I hand to the Minister to talk about exposure sites and testing, you'll have seen one of the cases attended the MCG on Sunday night for the Collingwood-Port Adelaide game, sitting at the punt road end of the Great Southern Stand at level 1. The AFL and the MCC have prepared for this moment. There's been extensive work over a long period of time between our public health team and our stadium management, and the AFL and the MCC were prepared for this. We're very grateful that we had the data on hand very shortly after it came to our attention, so we could contact all of those individuals, have them test and isolate until they receive a negative result, plus a small number who will have to quarantine. There's some more work to do, particularly looking at CCTV footage, and there were more exposure sites that have been listed, including an exposure site in Bendigo. So I encourage all Victorians to check on those exposure sites and make sure that if they attended any of those, that they follow the public health advice. We'll keep working through the interviews and further information, and there'll be meetings over the course of the day, but I want to be upfront with everyone this morning. I cannot rule out taking some further action, but we'll update people As soon as we know, it's fair to say that the next 24 hours are going to be particularly critical. So the message this morning is it's good that everyone is linked at this stage, but we are concerned about the number and also about the kind of exposure sites. And the next 24 hours are going to be critical if we're going to have to make any further changes beyond the changes that we announced yesterday. But to take us through in some further detail the exposure sites and the arrangements that we've put in place for testing, I'll hand over to the Minister and then we'll answer questions.
Thanks, Acting Premier. So I'll go through both exposure sites and arrangements for testing, and then happy to take questions. So in regards to exposure sites and personal close contacts that have been established, our tracing teams have been working, as the Acting Premier indicated, extraordinarily hard since Monday when the first of these cases popped up, building the contact lists and chasing down the different lines of inquiry. And I want to thank our contact tracers for the extraordinary efforts that they've put in and for all the assistance they've got from a growing number of exposure sites. As of last night, the department had identified 301 primary close contacts, and with negative tests available so far for 80 of those, with more coming in today. There are a large number of exposure sites linked to some of the cases announced yesterday. Many of them are Tier 1 exposure sites, and of concern are 3 venues attended by a case in Paran and South Yarra on Saturday night, that being the 22nd, and early Sunday morning. If you were at the following venues and at the following times that night, you are required to get tested and to quarantine for 14 days as a Tier 1 exposure site. Now those sites are 3 Monkeys on Chapel Street, Paran, between 9:10 p.m. and 11 p.m. The Somewhere Bar on Chapel Street, Paran, between 10:30 p.m. and 1 a.m. 3 Monkeys again at 12:30 a.m. through to 2 a.m. The Circus Bar on Commercial Road, South Yarra, between 1:30 a.m. and 4:15 a.m. Now those times overlap because the public health team have built in a buffer around the working propositions now of allowing for aerosol of the virus, so hence the crossover in times. Our team's been working through the night to get this individual's movements right across these locations and ensure that there weren't any others, but all the exposure sites that can be updated have been, but if new evidence comes to light, there will be further updates provided. If you don't know where you were, then you should call the coronavirus contact hotline just to get further reassurance. The best thing is to get, if you're not sure, contact us. Again, we would ask everyone to check the exposure sites as on the website and follow the listed advice relevant to either that Tier 1 or Tier 2 exposure site. In regards to testing, as the Acting Premier indicated yesterday, was a very high level of turnout, understandably, and I want to thank people for turning out in such strong numbers, and I want to thank people for their patience in assisting us in that testing to get that picture of where the virus is in our community. There are now more than 40 sites operating across metropolitan Melbourne with extended operating hours, plus additional testing sites, plus more staff, more infrastructure, more lanes, and more efforts to get people through as quickly as we possibly can. And we look to build on the increase of 30% of capacity yesterday, with further key sites being expanded today. In terms of those key sites, Western Health Showgrounds grew from 2 lanes to 4 lanes yesterday. Northern Health in Epping and Craigieburn increased staffing in response to very high levels of demands out in the north, and 100% of our retail driving staff are drive-in zones have increased staffing levels, all by at least 30%, some by significantly more. We've also established 4 new testing sites, and we'll have more to say about those as they are starting to get operationalised. And again, to see where to get tested, please visit www.coronavirus.vic.gov.au. Yesterday we also saw a record number of calls to our vaccine hotline, and we want to see another record there today. And we've seen very strong numbers of people showing up at those sites where you are eligible just to walk up and get vaccinated, and that has been a strong sign that people have got the message that if you are eligible to be vaccinated, please come forward and get vaccinated at either a participating GP location, of which there are multiple right across the state and certainly across metropolitan Melbourne, or indeed at one of the, more than our 30 state-run clinics, all of which are located on coronavirus.vic.gov.au. If you are eligible, call the coronavirus hotline and book a time, or just walk up to one of the sites that allow the walk-ups. Getting vaccinated, if you are eligible, is the single most important thing you can do to protect yourself, your loved ones and the community. So too does QR code checking at venues, so too does checking exposure sites, so too does getting tested if you display even the slightest of symptoms. We also now have an obligation to stick to the additional COVID-safe measures that have been announced by the public health team. Wearing masks indoors, our private gatherings in our homes of no more than 5, and our public gatherings of no more than 30. As the Acting Premier has said, if everyone with symptoms comes forward to get tested, with everyone linked to a current exposure site known to us, with everyone following the health advice and with our public health detectives staying on top of the chain of transmission, then we can run this down. It is in the hands of Victorians, but as the Acting Premier has said, the next 24 hours are critical, and we'll have more to say about that on the basis of advice following on from the further work of the detectives. But it's in the hands of Victorians. It's up to all of us as a community, and we all need to do our part. Thanks.
Thanks, Martin.
Just on the support for people that are self-isolating, are there still payments available?
In terms of support, thanks, Martin.
So there's increasing numbers of people now in isolation and quarantining at home and in other locations. So the same supports, all of which are detailed on the website and are available if anyone has any concerns by contact.
That includes the payment?
Including the payments, including all the support systems.
Can we get some thoughts from Brett? If there's
the exposure goes bars over such a long period of time, young people, is that your primary concern on both sides?
Certainly the fact that there have been exposures over a number of days that go back in time is a concern. You know, it's pretty clear that we have run down multiple generations of transmission just in the last 48 hours. That's been extraordinary work. And so finding the primary close contacts and getting them tested and identifying their own contacts and getting them tested and going to the next ring has been fantastic. But there's been a lot of chasing to be done effectively because we have had those individuals out in the community for some days in the past. So there are potential exposures there that relate to some days ago that are yet to potentially play out with new cases.
The advice you go to.
With case 5, which is effectively case 1, are you confident that you've got everything everywhere that person has been? And you look at that person as a super spreader?
Well, certainly case 5 has given us all the appropriate information. We have tracked down all of the primary close contacts and I'm not aware that anything's been missed in that regard, but that individual was infectious. So there are clearly a number of primary close contacts who've become cases from that case.
In terms of
On the
sorry.
bars, can I just go back to that? On the bars, are people using QR codes? Is there effective information there to track those people, especially the early hours?
Yeah, I don't know for these specific cases, but I think in general there's been good QR use. I would encourage everyone to use it at every instance, whether it's a mandated site or not, whether you're going there for 1 minute or 1 hour. It's a really useful thing for us to track down.
How are you going?
What's concerning you the most about it? Would you go to lockdown? Is it more exposure sites or someone not being linked?
Well, there are a whole bunch of elements we always look at, and we review everything every day. As the Acting Premier said, the next 24 hours will tell us if we've got further confirmed cases in the primary close contacts, 300 of which are known, and only 80 of which have returned results so far. Almost all of the remainder will come through today, but the exposure sites that they then generate, how many close contacts they might have, and how long they've been out in the community. So they're all factors that we need to consider over the next 24 hours.
Brad, did you consider recommending to James and Martin any further public health measures over the last 12 hours, or are you happy with the settings we've got?
No, as we've said, we'll have it all under review through further investigation of the epidemiology today. But the ink is barely dry on restrictions from last night. We will go through today's cases and all of the details behind them.
And on the missing links, I was asking you yesterday about the missing links in terms of yesterday, in terms of these new cases. Have we run all that to ground, or is there more to emerge in terms of links between everyone?
We may still see further links. So the only missing link is the link to the wallet case from South Australian hotel quarantine. All other cases, all of our 15 cases in this cluster, are linked. So we understand the relationships between all of them. We've got an explanation for how transmission has occurred. We may see new people coming forward testing positive that either tell us what that missing link is with the wallet case. In a sense, it really doesn't matter. We want everyone who's symptomatic to come forward and test. If they're linked, if they're unlinked, we need to run it down the same way.
How concerned are you that we don't yet have that link between the wallet man and this source case?
Look, it is a concern whenever we have cases with unknown acquisition, and so that's case 5 essentially. That case has done the right thing in giving us all of the information, and all of the subsequent investigations are running down, the chains of transmission subsequently. But there could be other cases out there. That's why we say, whether or not we identify you as a close contact or a casual contact, whether or not you've been to an exposure site, if you're symptomatic, please get tested. And that's the mildest of symptoms. It could be a runny nose, a sore throat, a fever. It might be aches and pains. It might be lethargy and a headache. It doesn't matter. Get tested.
We've seen a jump in cases.
Sorry,
and
Rich.
also
How many health workers have been furloughed as a result of this outbreak?
I don't have those details. The management of healthcare settings is with the healthcare setting itself. They're not part of the public exposure sites.
Do you have a little bit more confidence in more frontline workers being vaccinated? That you're a little bit more concerned?
Yeah, there's no question that the front-facing and most at-risk healthcare workers have been vaccinated at very, very high rates, almost universally. There'll always be maintenance as people move through in different roles. The broader healthcare worker workforce is pretty substantial, hundreds of thousands of individuals, but they're coming forward as well, and there's a very good coverage with them, and many of them up to their second doses now. So that's an absolutely reassuring thing.
And on the vaccines, this group of 15, how many should have had the vaccine? How many qualified for the vaccine?
Don't know.
How many over 50, I guess?
I don't know.
And
We can dig down.
reports today that 3 Victorians aged over 50 at the centre of this outbreak hadn't been vaccinated despite being eligible. How are we doing the right thing when it comes to vaccinations? How can this be improved?
We know there are still millions of over 50s who are yet to get their vaccine. I know many of them will have started booking now. Many of them turned up yesterday. That's fantastic. There are many tens of thousands, hundreds of thousands who can still get vaccinated now and should get vaccinated now. The concerns about clots, I understand. This is the same vaccine, AstraZeneca vaccine, that's been given to over 20 million people in the UK. The UK that is now down from 60 plus thousand cases per day to 2.5. It is getting over its pandemic through this very vaccine. There is always a risk with medications. And as vaccines go, and as the risk of clots go with the AstraZeneca vaccine, that is a much, much smaller risk than for so many other things in life.
How concerned are you that people in this cluster aren't yet vaccinated?
Well, it's my concern in this cluster, but across the population more generally. So if you're eligible, please come forward now, make a booking for today, for tomorrow, for the weeks ahead.
On Port Melbourne, there's a lot of cases that have come out of that one office. Is that a result of someone going to work consistently sick?
So, you know, a lot of people are asymptomatic and can still transmit. A lot of people will transmit before they develop symptoms. I don't have the specific details for these cases, but, you know, the message again to all Victorians, don't turn up to work, don't turn up to any events, don't go to family gatherings of any size if you've got symptoms of any kind. Get tested, isolate, get that negative result, and be happy that you can go to work when you're recovered.
You said yesterday that case 5 had likely been infectious as early as May 15. He didn't get tested until 10 days later. You've said you're confident that all the people who caught the virus from him, caught the virus since are linked. But how concerned are you that there could be people out there who caught it from him without realising it, given that he was out there for 10 days?
Yeah, of course I'm concerned. A lot of people have developed COVID from this individual. It is not to blame any one individual. We have all had contact with others close to us with sometimes very mild symptoms. And the message remains the same. You really must isolate and get tested, get that negative result before you should be interacting with others. But of course we're concerned. There's been transmission. It speaks to the infectiousness of this virus in general terms.
And just on the potential for a lockdown, you locked us down in February as a result of the UK strain of the virus. There was a lot of rhetoric at the time about that virus spreading at light speed and that being the reason for the lockdown. This Indian strain is regarded as being twice as infectious as the UK strain. Why lock us down then and not now? So
we will review through the course of today and tomorrow and the next day, whatever the settings are on any one day, we will look at that against the epidemiology. This particular variant, B1617, the sublineage 1 doesn't appear to be as bad as sublineage 2, which is the one that has taken over in India as the predominant strain, looks to be the predominant strain in the UK as well. So this lineage that is part of this cluster may not be as bad, but you're right, it's probably at least as transmissible as the B117 or UK variant, and we will have that in mind as we consider the epidemiology today.
Have the genomics, has the genomic sequencing results come back on most of the cases?
Yeah, so they will continue to come through as cases get notified each and every day. They have all come through with that same variant and with the same relatedness to the Wallet case.
Are you confident that these measures are enough right now? This virus has now touched regional areas as well.
As I say, we've run down 4 generations in the last 36 hours of transmission. That is a fantastic job. But we remain concerned by numbers. We remain concerned by the fact that we will have further exposure sites identified. What comes out of that is what we're watching today, and we'll continue to watch going forward.
If we're concerned, why are we waiting?
Sorry.
New cases in Ballarat.
Might let the Minister speak to that.
Of the existing cases, no, my understanding is that there's no new cases in Ballarat to report.
One in the city of Port Phillip.
Well, the workplace was in, the Port Melbourne is in the city of Port Phillip, as I know very well.
Present to Ballarat Health Services?
I beg your pardon?
Did any of the cases present to Ballarat Health Services?
Not that I'm aware of, but if there's further details to add to that, I'm sure we can provide further information in what is a rapidly developing space as the contact tracers go through their work.
Is there in Port Melbourne strain finance, and how many employees have been sent home from
My understanding is that is the workplace, and I want to thank that workplace management and all their staff for their support. My understanding is that all staff have been contacted and asked to test, and as a result, to isolate as a result.
Do you know how many in that building?
I'm not exactly sure, but I know it to be a large workplace.
Are any of these cases being treated in hospital at the moment?
Not to my knowledge, but we understand that this is a very serious virus. It has killed over 3.5 million people globally. This is not an issue to be taken lightly, which is why I take this opportunity again to stress, please get tested, get vaccinated, QR code, and follow the new rules.
Similarly, you were saying yesterday that you might be increasing eligibility for the vaccine. Has there been any changes since that press conference?
Yeah, as I mentioned yesterday, we are looking at what more we can do in terms of eligibility. We want as many people to get vaccinated as possible. So I'll have more to say about that very shortly. We're just working through the details of what that looks like and getting advice from public health. But we are keen to explore what we can do about increasing eligibility. We had a wonderful result yesterday in terms of the number of people coming forward and getting vaccinated. There are millions of people eligible already right now. And as I said yesterday, don't wait for tomorrow, don't wait for next week. If you are eligible, call the hotline and get vaccinated.
James, how are the negotiations with the Commonwealth on an alternative quarantine site? We heard it last week that they prefer Adelaide or Victorian. And does the factor in this situation now getting into hotel quarantine, would you like to see some more urgency in those negotiations?
Look, I would, and as I've said consistently, and the Treasurer is talking to this yesterday as well, the discussions between Commonwealth and state officials, between our two governments, is proceeding very, very well, but you are right, there is a sense of urgency about this. The best time to have had an alternate quarantine facility is 12 months ago. The next best time is right now. So we are very, very keen to finalise those discussions with the Commonwealth and have the Commonwealth provide the green light. One, in terms of access to the site so we can crack on and do the planning and the design work. And secondly, commit to the funding of its construction.
Is the federal government doing enough when it comes to
follow-up
vaccines?
to that. What is the sticking point? You guys say that you've got a really detailed proposal. It's been 3-4 weeks now. What is the main sticking point why they haven't given the tips?
Oh, look, we're working through the details. As I've said before, the key thing for the state government on behalf of all Victorians is that we want an outcome that reduces the risk in hotel quarantine. And we're talking today about an outbreak, and everything that we are doing and everything all Victorians are doing to make sure that we get on top of this. But the genesis was a breach at a hotel in South Australia, and as we've consistently said, hotel quarantine is not a no-risk environment, and we must have alternative quarantine options, particularly for people of highest risk. So I'm very hopeful that in a very short space of time, and believe me, there is a strong sense of urgency from the Victorian government on this. We've had very cooperative engagement with the federal government, and I'm very hopeful that we'll have a positive result very shortly.
Is the federal government doing enough when it comes to vaccines?
Sorry, how to go yet?
Sorry,
regarding football crowds, the advice this morning, do you think that will stand up by the end of the day?
Well, that's correct in terms of where we are right now. So AFL football going ahead with crowds, subject to masks and other changes, but there's been great engagement between the league, between our stadia and our public health team. But this is just like the settings that we announced yesterday that were put in place last night. This is subject to how we go over the next 24 hours. We've got a critical period in front of us, but right now, engagement between the AFL and public health, games with crowds subject to some restrictions.
Just on the Port Pies game, some registered ticket holders gave their tickets away to other people who haven't now received that text message that went out last night. Other people have received the text message but never registered. I guess how's that being managed?
Look, we're talking about tens of thousands of people, so there will be, a few where an incorrect mobile phone was put through the system, and those individuals are getting a call. That's just the nature of when you're dealing with tens of thousands of people, but our contact tracing team will work through that, either if a mobile phone is to a person who did not go to the game, or indeed people that pass on their tickets elsewhere. So contact tracers will follow that down, but as I said at the outset, the AFL and the MCC and other stadium managers have been very well prepared for this eventuality. We got the data immediately from the stadium, and we're able to do the contact tracing and get in contact with people who attended those games and really focus in the level, in the area where people were sitting to watch the game.
On those fans, some of those South Australians are not get returned back to South Australia. Do they put Adelaide supporters like that? That group of fans put Adelaide supporters when they return to South Australia?
Well, I would imagine whenever you have an interstate team playing at the MCG, there will be fans that travelled into Victoria to watch it, so they'll be chased up just like anyone.
Can I just ask you a question on vaccinations? Just in regards to with the people who've had the AstraZeneca one jab, is it worth them getting Pfizer their second jab, given we've got an outbreak of immunity and its effectiveness against the Indian variant?
No, not at the moment. That's for ATAGI, the Australian Technical Advisory Group on Immunisation, to make the call on. But AstraZeneca single dose provides good protection. It provides extremely good protection against hospitalisation and serious illness, and so it's just worthwhile to get that vaccine. It should be followed up on current recommendations 12 weeks later with the second dose. The mixing and matching of vaccines is a matter for ATAGI nationally, but there's no reason to believe that you can't get a follow-up dose with AstraZeneca that doesn't work extremely well.
Should national efforts on the vaccine be concentrated in Victoria given our current outbreak? Would you like to see more vaccines going from other states where the risk is lower come to Victoria?
The issue now in Victoria is people coming forward to get the vaccine. We've got the supply, we've got the infrastructure to deliver it. We want people to book in, to walk in and to get the vaccine. So I don't think there needs to be some shift in the distribution of vaccines nationally. That said, the most at-risk individuals are the ones that we'd like to see prioritised, and that needs to happen across the country.
We have no jab, no play rules. Should we be looking at that for COVID vaccine?
Again, a matter for
James?
National Cabinet.
Brett just gave my answer. It's a matter for National Cabinet. Any of those broader settings would be subject to discussion at National Cabinet, advice from our various public health teams.
But as a participant in National Cabinet, do we need to take a more stick and carrot approach to this now, given the amount of people who aren't turning up to get their vaccination, and others who are waiting to get it?
No, I think the one positive out of all of this is the massive increase in the number of people coming out yesterday to get vaccinated. Right now, we don't have a problem with the supply. As I've said a number of times, at our state sites, we've got the capacity to do 2 to 3 times what we've been doing, and we saw that yesterday. So we can replicate yesterday's number every day and do more. And people see the incentive. We know that the best way to defeat outbreaks and the best way to defeat the pandemic is, one, the successful rollout of the Commonwealth's vaccine program, and secondly, have an alternative quarantine system, particularly for our most highly at-risk individuals.
Is the federal government doing enough when it comes to vaccine supply? And if this latest outbreak does lead us into a lockdown, are you going to take a tougher tone to National Cabinet?
Well, supply has been a particular challenge for much of this year, and there's no doubt that the Commonwealth's vaccine program has been significantly delayed, and there's global reasons for that. There's no doubt the Commonwealth's vaccine program has been significantly delayed to date, but right now we've had additional supplies of Pfizer. We've got enough AstraZeneca. So right now supply is not the issue. Right now we need people to pick up the phone call the vaccine hotline, book an appointment and get vaccinated.
Are you worried?
At the same time, we are looking at how the best way to expand eligibility.
Are you worried that we don't have a sufficient enough supply of Pfizer to cover all of the younger age group, considering that we seem to be the ones going out and spreading the virus, even though we might not be the most vulnerable?
Well, I'm not sure about the last part of your question, but in terms of supply of Pfizer, right now the answer is yes. Now we need, over the course of, between now and the end of the year and beyond, we need consistency of supply and confidence that it will be there. So that's one of the things that we've got to have in our mind when we consider how we will expand eligibility, is that we need to have confidence, not just in 1 week, but in the long term. And that's the key issue for all states and territories and the Commonwealth, who are responsible for supply.
Do you believe the government when they say that everyone's going to be vaccinated by the end of the year?
Believe the federal government?
Yeah.
Well, it's dependent on supply, and it's dependent on the Commonwealth delivering the supply numbers, whether it's Pfizer, AstraZeneca, or other arrangements that have been made with other vaccines.
I've got a question on tier 1. Sites. Could be for Brett, I'm not sure. Are you having trouble contacting businesses that are in those tier 1 sites, or are you getting onto people quite quickly to let them know they are?
Yeah, I'm happy to flick to either Brett or the Minister.
So if I understood the question right, tier 1 exposure
Are
sites.
you getting onto business owners quick enough to let them know they are tier 1 sites?
Oh, look, there's yes is the short answer. If we contact a hospitality venue that's open till 4 a.m. at 6 a.m, it's probably not surprising they're not there. But we are getting onto them fairly quickly in all regards, and I'm not aware of any particular challenges. If there are, we'll work through them. And I want to thank all of the tier 1 venues, big and small, community and commercial. They have been really, really supportive.
Why did that, there's a bar in Koran, I think, for 3 months, why did they put it up on their Instagram site before it was on the government website?
Out of an abundance of making sure that they were doing the right thing by their customers and their clients.
But doesn't that give customers a lot of fear, given that a business
If I could finish my answer. It's equally important, once we make contact with our contact tracers with a venue, that we then go through the process of getting the data and confirming all of those arrangements and confirming the details, a la Epping North, to make sure that the material is accurate. And I commend any venue who then take their own initiatives to contact their clients and their customers. It shows the system is working, and in fact it shows very quickly that our contact tracers are getting those sites up and running as quickly as they possibly can.
Should that
as
time-
public
Just follow up
exposures.
on my question. So on that, how long on average does it take between speaking to a venue, telling them they're tier 1, and then getting up on the
Look, on average, I don't know that. It will vary from big, small. If you're talking a global, multinational retail chain versus a owner-operated venue, there will be differences.
Can I just ask Mr. Molino, just back to our previous line of questioning, have you been on the phone to Scott Morrison regarding the situation here in Victoria? Convey to him, I guess, the public health advice, 1, and 2, whether, as what Rich was saying, some of the vaccine distribution, thoughts should, be rethought.
So in terms of the last few days, I haven't been on the phone with the PM. We're doing exactly what Victorians would expect, that is working every minute of the day with the public health team. We've got the Committee of Cabinet responsible for our responses to the outbreak. So that's what I've been focused on in the last 24, 48 hours. The engagement with the federal government has been significantly on the alternate quarantine facility. That is the most important thing we need to get settled right now. As you've heard from the three of us, we've got the supply that we need right now. We need people to come forward and get tested if they've got any symptoms. We need people to adhere to public advice, public health advice if they've been to any of the exposure sites, and we need people to come forward if they're eligible to get vaccinated. So that's what I'm focused on at the moment. There'll be some broader issues that will be discussed when National Cabinet meets. But the most important thing in terms of engagement between us and the feds right now is finalising the alternative
Are you
quarantine facility.
frustrated?
Sorry, Julie, the alternative quarantine facility, that's months away, right? Now, we're in the middle of responding to a public health outbreak.
Yep.
Why not get on the phone to Scott Morrison? I know when we were in the theatre all last year, Mr Andrews would come in and say, I've been on the phone to the Prime Minister to update him and ask for support. Why not ask for that federal support?
Simon, because what we need is right here already. What we need is right here already. We've increased the capacity at our testing. We've got the vaccines that we need. We need people to come forward and get tested. Believe me, if there was anything that we needed right now from the federal government, I'll be on the phone. What we need is for people to get tested, for people to follow public health advice if they've been to the exposure sites, and for people to not delay, if they are eligible, get vaccinated. The alternate quarantine facility, every day that we don't have a decision is a day that's delayed. We will have this pandemic with us for quite some time. We will have high-risk cohorts travelling back to our country for quite some time. So we need an alternate quarantine system in place to deal with our highest risk individuals.
Are you frustrated that our rollout of the vaccine in Australia is still so far behind other countries like the US and UK, now that COVID is still impacting the lives of Victorians?
Well, it's a challenge, and it is a fact that the Commonwealth's vaccine program has been delayed. There are global challenges with supply. There's been the hit to public confidence in terms of AstraZeneca, which meant that we did see a dip in the number of people getting vaccinated. So that is a massive challenge. The way through this pandemic is the successful rollout of the vaccine and an alternative quarantine system, so we can deal with our highest risk.
Why do you think the federal government is still not putting out a solid marketing campaign to get people jabbed?
Look, it's a good question, and one you need to put to the federal government. The vaccine rollout is a Commonwealth responsibility. National Cabinet at the last meeting were advised of a public awareness campaign, an advertising campaign to encourage people to get vaccinated. Those are questions you should put to the federal government.
The next 24 hours.
Well, that will be based on public health advice, but as we have all said here this morning, the next 24 hours is a critical time. We can get on top of this if people get tested, if people follow public health advice, if they've been to exposure sites. We can follow this chain of transmission, and we can get on top of this, but the next 24 hours will be critical.
So what would you like to see?
Exposure sites that aren't currently listed publicly. Are you aware of it?
No, I'm not.
So what would you like to see in that 24 hours? Is it less cases, no more exposure sites? What would you like to see?
Well, as the Chief Health Officer outlined this morning, there are a number of factors that come into play in terms of the advice that we receive from public health, if there needs to be any further changes to the ones that we announced yesterday. But as Brett said, the ink is even dry on the changes we made yesterday. Victorians are doing the right thing in terms of wearing a mask, in terms of making adjustments for those private gatherings inside or outside the home. But the next 24 hours will be critical.
But why are we waiting? This has already reached the regions. Doesn't there need to be more restrictions?
No, we make the changes based on public health advice. That is what we have done every single day for the last 16 months of this pandemic. So we make the changes, we make announcements, we respond to the advice we receive from public health. The advice from public health are the changes, the announcements, the restrictions we announced yesterday that came into effect from 6 p.m.
But clearly it's on the table that more restrictions will come in place, and if we wait, they may have to go for longer. So why not just go hard and go early?
Look, I'm completely upfront with you this morning. The good thing is that we know there is a link with all of the 15 cases as part of this outbreak. The good thing, we know there's the link that goes back to the hotel breach in South Australia. These are good things. We are concerned about the number and the kind of exposure sites we need to see the impact of, one, the excellent work of our contact tracing team, the last 36, 48 hours, going through those 4 levels of investigation, the work of the contact tracing team, the impact of the changes that we announced last night. The next 24 hours will be critical. I'm being completely honest with you. We are not going to foreshadow what those changes may or may not be. It will be dependent on what happens over the next 24 hours and the advice from the public health team.
But there's still no link between the wallet man and this source case, so why are we waiting? How bad do you think things are going to get?
Well, we make decisions based on public health advice today and every single day. That's what we do.
Do you know what portion of elderly Victorians, those 70 and above, have got at least one dose of the vaccine, and what role, if any, does that play in our ability to resist further restrictions or lockdown?
I don't have the exact figure. I think it's getting to a reasonable level now nationally, not at that safety zone of herd immunity, if you like, for that cohort of people. And the protection of those 70 and above is not just their own vaccination status, but it's everyone getting vaccinated, all of those that they might interact with. I do know that the aged care system, private and public, has had extremely good coverage, especially in the city of Whittlesea. So that's reassuring, but there'll be new residents going into aged care as well, so there needs to be a maintenance program of vaccination in those settings also.
Does it play a role in your thinking on further restrictions at all?
It's not a primary role. It's something I'd like to obviously see continue take up of vaccine for those most at risk. But in terms of the transmission risk, the transmission potential, vaccination is not at the kind of levels that make a difference now to the speed of new generations of cases.
Given that testing...
Is there any prospect of localised restrictions or lockdowns, or are we beyond that?
Well, we've got it in essence with Metro Melbourne, but we've got significant spread of exposure sites at the moment, so it's not something that we would look to at a postcode level, I think.
Professor, are you comfortable with the AFLs going ahead on Friday night?
So we are reviewing today and through the rest of the week those settings, so nothing more to say on that.
Is there a chance that will be slashed?
So there's everything's on the table. In the review of restrictions, including for public events, everything's on the table.
Can I just ask one variant? We are still dealing with the Indian variant for all of these cases?
We are. It's the Indian variant for all cases.
There are reports that one of the latest cases is a Melbourne Metro Trains customer service officer. Are you aware of those?
I'm not aware of that.
So you don't know whether
I don't know.
it is?
I have a question on an unrelated COVID
Well,
matter.
is it testing?
No.
Just really quickly, we're still seeing massive delays. I know that you acknowledged some sites have increased capacity, Martin, but people are being turned away, and this is the critical 24 hours. How, are you doing anything to fix that? Because people could become discouraged at a time that we need that swab.
I want to thank everyone for their patience, and I want to refer again, as I did yesterday, to the tool that's on the website about active queue management. Where are the testing centres that don't have the kind of wait lists that we're seeing, particularly in some areas of the north, the big, well-known ones. So yesterday we saw an outstanding effort. Over 26,000 tests came in by midnight. A further 10,000 over the hours after midnight. That will be in tomorrow's numbers. We're already seeing extraordinary turnouts again today. I know that waiting in a queue is not anyone's idea of fun, but you are making a significant contribution to the well-being of yourself, your family and your community, and we are throwing all the resources we can at addressing those queues. So please hang in there, actively monitor the website, look to the active monitoring of those sites that may not be as busy as others, and hang in there and get tested.
What are those resources? Is it more staff? Are more staff coming on?
There's more staff, there's more equipment, there's more lanes. We're throwing a heap of resources, and there's more centres being established.
Sorry, you go.
How did the positive cases went to the footy games get there? Did they get public transport, and are there any other public transport exposure sites?
I know that there's been conversations with that person in regards to that. I don't have the answer to that, but I'm sure we can brief you further.
Do you know what case that person is?
I beg your pardon?
Do you know what case that person is?
I do, but I'll get that to you rather than, well, it's clearly one of the ones related to post-case 5 transmission through personal close contacts, but in regards to which particular one, I'm sure we'll get that to you.
Just on an unrelated COVID matter, last night the City of Melbourne moved a motion supporting the establishment of an injecting room in the CBD. Does this pave the way for the government to confirm that the former Uralla building will be where the injecting room will be set up?
So I did note the City of Melbourne resolution. They've raised some significant issues with the state as a result of that. We'll work through those issues in a calm and measured process. And in regards to the specific locations, I think we've said on a number of occasions, the area with the greatest degree of harm occurs around that 250 metre radius on the corners of Flinders and Elizabeth. That is right now where, on average, across the City of Melbourne, that is the hottest spot where, on average, someone is dying once a month, and there are overdoses on a regular basis. We need to make sure that the recovery of Melbourne is a recovery for everyone. We'll work through those issues with the city, and I look forward to that. In regards to specific locations, we will have more to say about that when those conversations with stakeholders are resolved.
Just on the radius you just mentioned though, does that then rule out the current site next to the Queen Market?
We're working through all of those issues. The City of Melbourne made it clear to us last year that that was not a site that they were prepared to support. We've engaged in a process with the city around that, and that process is yet to be completed. And we've got question time soon, so if you'll excuse us.
Thank you.
Thanks, everyone.
Thank you.